hernia is a hole in the wall. It occurs when there is a defect in the hole in the strength layer of your abdominal wall, which is also known as the fascia. A hernia commonly occurs within the torso between the chest and hips. Common sites include the groin and belly button. Sometimes underlying fat or an internal organ can protrude out through the hole, and this results in a bulge. Common symptoms of a hernia include a bulge and pain at the site. In some instances, hernias can cause intestinal obstructions. That becomes a surgical emergency. Common types of hernia include umbilical and inguinal. Other types of hernia include incisional and femoral hernias. Most hernias will not go away on its own. Most of them require surgical intervention. This is due to the fact that a hernia is a defect in the abdominal wall and the strength layer of the abdominal cavity. There are some exceptions to the rule. During pregnancy, some women experience an umbilical hernia. Most of these will resolve on its own after the delivery of the child. Most other hernias will require surgical intervention.
Different types of surgeons that repair hernias include general surgeons, some that are specialized in minimally invasive or robotic techniques, and plastic surgeons. Sometimes the plastic surgeon and the general surgeon will repair the hernia together. If hernias are left untreated, they can sometimes become larger or symptomatic, where they are painful, or parts of your small intestine or colon can fall into the hernia and make bowel movements or physical activity difficult. If the contents that are in the hernia start to get squeezed and lose their blood supply, it can become an emergency where we have to go immediately to the operating room to repair it, sometimes having to resect part of your intestine or colon. So if you have a hernia that requires repair, then you should definitely see your doctor sooner than later so we don't ever run into that emergency situation. Hernias are treated with surgical repair as long as you are able to undergo a surgical procedure. The hernia is usually closed with sutures in some fashion and then reinforced with a mesh. The mesh is usually made of a polypropylene, sometimes an absorbable type of material that are secured in place with either sutures or clips that are also sometimes absorbable. The hernia repair is usually done in an operating room under general anesthesia, sometimes laparoscopically or robotically, or through an open procedure, which may be an incision overlying the palpable hernia. Recovery after hernia surgery is usually about 1 week of being out of work and feeling somewhat sore, and then followed by 6 weeks of no heavy lifting, nothing more than 5 to 10 pounds. A gallon of milk is about 10 pounds, so you won't be able to lift anything more than that for those 6 weeks after surgery. If your job requires you to do heavy lifting, sometimes your employer can offer you a light duty position, or we would keep you out of work for those 6 weeks. After your surgery, we would see you in the office and make sure everything's healing well. And then once you've met that 6 weeks of no heavy lifting, you can slowly resume your regular physical activity, including lifting and exercising.